Hi, my name's Bea and I'm a labour ward coordinator at Yeovil District Hospital, and I'm also seconded to work within the West of England Academic Health Science Network.
Hello, my name is Becky Cockings. I'm the Deputy Antenatal Screening and Bereavement Midwife at Yeovil Hospital, and the title of our project is Does Training Impact Midwives' Understanding of the Implicit Bias in Neonatal Care for Black, Asian and Minority Ethnic Babies?
So part of our research involved developing a training package, and this is the first slide that we use in our training, and we wanted to share that today because the same applies really. It's good to ask questions, and we won't always get everything right the first time, and to improve care we do need to start to be comfortable being uncomfortable and having difficult discussions, but equally we need to look after our own well-being, and if any of the topics feel, because they are they are quite distressing, if any of it feels too much, then just log off and log back on again.
So part of the background of the project that shows a vital need for change is the Embrace report on the mortality rates for women and their babies. So for every 100,000 Black women who give birth in the UK, 34 will die. That compares to 15 Asian women and 8 white women. And the overall stillbirth rate in the UK, which we know has reduced to 3.74 per 100,000 births in 2015 to 17. But for Black babies, the stillbirth rate is over twice that of white babies. And for Asian babies, the stillbirth rate is 60% higher. The overall neonatal death rate in the first 4 weeks of life is 45% higher for Black babies and 60% higher for Asian babies. And there's been shown to be no significant changes in mortality rates for ethnic women since 2014. We're becoming more aware of the disparities in outcomes for women, but we found that less midwives were aware of the disparities in outcomes for babies.
So after recognising that there was more work that's needed in this area, we started thinking about the training that we've received in the past, and wondered why we'd never noticed before that all the mannequins used in any kind of training represent white babies and white women. And this is where Bournemouth University were kind of instrumental in helping us, because they had an incentive that was £1,000 for 1,000 words. We wrote £1,000 words about a change in practice that we wanted to see, and were lucky enough to win the competition and have some money towards buying some new mannequins that you can see pictured there. They encouraged us, however, to turn it into a bigger quality improvement research project and develop a training package that we could evaluate, rather than just introduce the dolls into training, to put something around that, which we've written up and then is being published this month in the British Journal of Midwifery. And we're really pleased with the new dolls and the training that we have, but we didn't want to make more work for ourselves when it came to developing the training package. So before we put it together, we wanted to see what was being done elsewhere, to see if there was something that we could replicate, and also to kind of establish a bit of a baseline. We sent out 3 questions for trusts across the UK via the regional chief midwives, just asking if there was any specific training around care of Black and Asian babies, different assessment tools that are used, and for women as well. And we also asked if they use any mannequins that represented women and babies from Black, Asian and minority ethnic groups. We didn't get a huge response, but the response we did get indicated that other trusts mirrored our trust, and that there wasn't representative training of all women and all babies across the UK. But we kind of felt that wasn't probably wasn't statistically significant. We didn't get a huge response. However, since then, the Mind the Gap report was published at the end of 2021, and indicated that what we found was absolutely valid, in that there is very little specific training around care of women and babies from different ethnicities.
So for the training package, it was co-produced with Emma Simmons. She is the Equality, Diversity, Inclusion Lead at Yeovil Hospital, and she presented lived experiences of Black women in maternity care. She had some personal experiences to share, positive and negative, and we presented the statistics and outcomes for mums and babies as we've done to you today. We explored conscious and unconscious bias, stereotyping and institutionalised racism, discussing the impact of this on clinical care and outcomes. And Emma sort of really homed in on those light bulb moments from the training package where midwives are really sort of seeing those things that we were talking about, and then actively wanted to challenge them, which was really good. This is a picture of myself and Bea at the Maternity Safety Conference last year, where we presented our pilot training data in a poster, and we came second in the competition. And positively, with our training, over 75% of the midwives at our trust attended the training. And we have 3 slides from our training package that we would like to share with you to give you a sense of how we started to tackle the topics.
So this was the first slide that we shared, and we kind of put it out there as a question. We reiterated that this is a safe space, and that there's no wrong answers, and just to kind of share what kind of came to mind. If there was silence, then we would kind of prompt with, are you not answering because you're shy, or you're not sure, or because you really don't know. And what came back was that midwives are very aware of the Embrace report and would give us the top reasons that mums and babies die, and thromboembolism, sepsis, bleeding, all of the different causes of death. But no one really understood why certain mums and babies were more likely to do that. There were some answers like certain groups of women are more likely to get gestational diabetes, and we say, okay, so how does gestational diabetes lead to maternal death? And really tried to kind of home in, and there weren't many kind of midwives that were forthcoming with, well, we know that care is affected by bias or stereotyping or anything like that. It was all very kind of physical reasons.
So an important quote is, it's not race that kills, it's racism. And simply by improving standards of care, mortality rates can be drastically improved. And it's not groups of people that are different, but how those groups are treated. One answer as to why more mums and babies are dying is bias and stereotyping, and how that affects care that's delivered. No one thinks they are biased or have biases, but we do need to self-reflect and work with our biases rather than being closed to the possibility of it. Dr. Christine Akechi, who presented at the National Maternity Safety Conference last year, stated there are no biological reasons why these women are dying.
So one of the other things that we did was that we had these different quotes, and we asked midwives to go around the room and to read them out in their own words, using their own voice rather, so that they heard the words coming out of their mouth, and they also heard their colleagues saying these. They're hard to read and they're hard to listen to, but they're all phrases that have been presented at other conferences on inequality, and they are stereotypes that are held, unfortunately. One of the things that we did was to show part of the Black maternity scandal documentary, where there's a woman really clearly articulating that in there that, did I not speak up because I was scared of being seen as the aggressive Black woman, and would that have made a difference to her care? We were really clear that that it's not something that just happens in other places, that doesn't happen here, and also that women are disadvantaged for several reasons, women and birthing people, so same-sex couples, teenage parents. We know that lower socioeconomic class, there are lots of groups of women that are less likely to attend antenatal classes, to attend different appointments, and to all have poorer outcomes. But the Black, Asian and minority ethnic women have that worse, and if you layer those different inequalities on top of each other, then you increase that risk.
So the training package was developed with support from the head of midwifery and the chief nurse from the trust, and we developed pre and post training surveys and collected basic demographics and in-depth questions to assess baseline knowledge and evaluation of the training. We delivered this training mainly face-to-face, with the option to join virtually to help people who are isolating due to COVID, etc. And we managed to get some funding to give midwives paid time to attend, which was good. We used descriptive analysis for the statistics and thematic analysis for the free text answers.
To start sharing some of the findings, no one rated the training below a 3 out of 5 for how useful it was, and actually 83% rated it as a 5 out of 5, which was really positive. 98% of midwives said that they learnt something new in the training, which is great for us when we're evaluating how useful that training was, but does demonstrate that there are gaps in education and from what for midwives. So we kind of have identified that, and 98% of midwives, so all the midwives that said they learned something new in their training, 98%, all those midwives will also change their practice after the training, which is huge, hugely significant. And there's some of there's just a list there of the different ways that midwives said that they would change their practice. So some around documentation and care planning, how they're going to have discussions with women and families. 96% are going to change the hands-on care that they provide, advice, and also 42% said that they would challenge stereotypes and change the way that they communicate now.
So 38% of midwives had not heard of the term implicit bias prior to the training, and interestingly, even those who heard of it were not aware of the impact of it. And after the training, 98% of midwives felt that the APGAR scoring system was not the most appropriate assessment for babies. And this was because we raised in the training that there are many babies that are prevented from achieving a 10 out of 10 in the first test of their life because of the language used. And we also discussed that the language of the APGAR scoring system is not inclusive.
Some of the questions that we asked were the same pre and post to give us comparisons. So we asked, do you feel that maternity guidelines are supportive and inclusive for all women and babies? And that you can see that was about 50-50 before the training. Post training, 96% of the midwives that attended felt that it wasn't, that our guidelines aren't supportive and inclusive for all women and families and babies. And again, we posed a yes or no, true or false question. There are no differences between assessment of babies from different ethnicities. And again, 40 to 60%, and post-training, 93% of midwives felt that there are differences when assessing babies from different ethnicities and changes that need to be made.
So with the thematic analysis, we found 3 themes, and for time, we've just included one of the quotes from the midwives that highlighted each of these themes. So shocked about inequality and impact of bias was one of the themes, with midwives saying things like, I didn't understand the differences before the training today. There was a definite trend of being positive about change, and how midwives found it really useful and felt that they would change their practice in a positive way, and they felt passionate about the care change. There was a small theme of not ready to accept, with comments like, I don't think I personally would. As a mainly white British group, it's inevitable that there are going to be biases.
For those of you not familiar, this is Mammy and Kenneth Clark, and in 1939 they discussed the danger of unchecked and unchallenged bias in society. And despite this research being conducted over 80 years ago, our project has identified that 38% of all the midwives hadn't heard of implicit bias before the training. And although the more recently qualified midwives were more likely to have heard of implicit bias, over half of them still felt that maternity guidelines were supportive and inclusive of all families. And that to us indicated that while you've heard of it, you're still not able to identify bias within policies and guidelines and training that aren't set up and don't cater for all women and families. And therefore it could be argued that there are lots of midwives practicing whose biases are unchecked and unchallenged. In both Embrace and further publications, bias, stereotyping and microaggressions are citing as impacted on the safety of mothers. And there's other research that describes disparities existing at all levels. So that's structural processes and outcomes within neonatal units, which really severely disadvantage Black babies. At the end of 2021, there was a HSHIP report that came out, and Becky and I rewrote part of our article for the British Journal of Midwifery afterwards, because it was so significant and exactly what we're kind of talking about. Following the really sad death of a 3-month-old baby, the recommendations were made to SPOT, the chair of SPOT, which is the NHS system-wide paediatric observation tracking programme, to say that you need to ensure that resources are produced to give examples of Black and Asian babies when they're demonstrating signs of serious illness. And that's because despite the mother's concerns in this case, really important clinical signs, including assessment of colour. So when you're assessing colour, really it's perfusion and rash were missed in this case, and this baby really sadly died.
So recommendations for practice, these are our recommendations. The impact of bias and microaggressions is being recognised more and more often as a contributing factor to mothers and babies dying. Training to understand the rates of inequality for both women and babies and impact of bias needs to occur regularly for midwives and other healthcare professionals. Continued poor awareness of implicit bias and its subsequent effect on patient safety must be understood to provide families with safe and personalised care, and we need to work to reduce unacceptable disparities. Maternity units need to look at with fresh eyes at their guidelines to ensure they are inclusive, and training equipment needs to be representative of the population. But more than all of this, we need to understand why there are such huge disparities. We need to consider the language used, the use of the APGAR scoring system as it stands today. And while we are trying to better understand the why, we need to not do any more harm. We need to listen to women, listen to their families, and work with them to build trusting relationships.
So in terms of next steps for us, since we a couple of months ago we presented to NHS improvements, and since then we're from the southwest of England, and all the trusts in the southwest have had dolls purchased for them that represent that, you know, like the mannequins that we showed in the picture, that to represent Black and Asian babies, to be more representative of the population. We really feel that just introducing dolls on their own won't make all of those changes. It's about having the discussions, it's about understanding bias, and it's about it's about more than just a doll. But that's a huge step in the right direction to make our training equipment representative of our population. We are really interested in developing a kind of train the trainer model, so that this that training like this can be delivered across other units, and looking at working with the Southwest Academic Health Science Network to see if there's a way that we can kind of scale our project up. But we're hoping that when it's published, it will and midwives read it, that it will help them reflect on their own practice and make changes. Their own practice would be a huge win for us, really. And we'd welcome any thoughts, kind of feelings or reflections. To our contact details be available, so please do get in touch with us.